back, everyone. Welcome to my garage. I wanted to give a little bit of an update on how I decided to treat my cancer. In one of the last videos, I mentioned functional medicine versus traditional chemotherapy oncology, and what I decided to do was to go with the traditional chemotherapy oncology. And as I was searching the natural methods or the functional methods, and I still think they could be options maybe in the future, but as I was going through this myself, something that kept coming up for me personally was when I spoke to the oncology teams, whether that be gynecology oncology or the medical oncologist, the treatment was told to me to be the most effective, the chemotherapy 4 to 6 weeks post-surgery. So after I had my surgery, that's when the chemo is the most impactful. If you go beyond that, it becomes less impactful. So that was something that I kept on my mind as kind of a timeline. And the first 2 weeks after my surgery, I was struggling mentally because of medications, because of lack of sleep, because of pain keeping me from sleeping, and that sleep deprivation just put me very behind in my ability to keep up with what my treatment options were. And so that really only gave me a couple weeks. And in that couple weeks, I did my best. I was absolutely exhausted. My brain was seriously tried in energy and effort, and trying to make it to the doctor. I had to wait 2 weeks before I could even drive to even visit some of these places. So as quickly as everything had happened with my case, finding it, getting to the doctor, getting to surgery, just how quickly everything went. I did my absolute best with the time that I had. And when I was speaking with my functional medicine doctor that I had been working with for the past 6 years, I personally just didn't feel the comfort level in cancer treatment that I needed to feel from that plan. I felt like a lot of pressure was put on me as the patient to be able to make these therapies even an option or make them work. And as exhausted as I was, I could not even fathom having to do that. Like, I needed someone to coordinate it. You're the central person. You tell me where to go, and I will get it done. Not me be the central person, and then I have to figure out how to get this done. It was just too much with changing my diet, trying to find someone to deliver a therapy or deliver it myself or whatever it was. It just wasn't working out. And then I went to a couple other options, and I also just did not feel like those were great options for me. When I went to my medical oncologist, he was able to show me research, and I know how to assess research. These were, articles within the past 5 years. I could see where the studies were coming from. I could see the data right in front of me and the graphs and everything. And he's like, here, look at this. He was very transparent with how the therapies work, and talked to me about my age and talked to me about other patients that were my age and patients that were even older than me that had been doing well with these therapies. Because when you look at the statistics for my type of cancer, high-grade serous stage 3B ovarian cancer, the statistics are not good. The prognosis is not good. So, but most of those statistics are based off of people that are much older than me. Like I said before in another video, 50 to 60 years old or older. So when you're that age, you have more time to have more comorbidities. You don't recuperate and recover as fast as a younger person might. So it's possible that I could be more, receptive to the treatment than somebody else, just based on my lifestyle, number one, and my age. I am 38 years old, but I often get asked if I'm 20-something, and I think it's because genetically, number one, but also because of the type of lifestyle I've lived since I was a child, being very active, being very interested in health and health conscious, and consistently involving how I'm going to take care of my body. So I decided to go with the medical oncology route and to get the chemotherapy. And it's something I had never thought I would have considered. I mean, for the past 6 years, I was, very turned off by medications. I've had a lot of reactions to them. I don't respond well to them in general. And I just never thought I would choose this. But when you're faced with these decisions in the time that you have to do what's best. And I do believe I've done what's best for me based on the information that was presented. And what I ended up doing was I ended up getting a port. It's called a Mediport, and I'll show that to you right now. I'm just going to move this so we don't... what they do is they go in here and they shove this port down here, and this is my right side. And there's a line that goes into your central circulation, which would be right into your heart. So your superior vena cava, it's in your vein, your venous system, your veins. So they put the medication right into your veins, and it goes into your central system, which is your heart. The other option was to get something called a central line. And that would have been, installed in my arm, and it would just be almost like a giant IV that kind of like hangs off of your arm. And because I'm so active, this would require, more care for the shower, more care when I'm active, keeping it clean and etc. So the port was best for a very active person. I can shower with it. There's no issues. I don't have to cover it or anything. The third option would just be to get an IV every time that you go in for chemotherapy, and they would just place it, give your chemo, and then they would take it out and you would go home. They assessed my veins and just said, your veins aren't big enough. You're going to infiltrate, which means the medication is going to come out of the vein and go into your tissue under your skin. And if it goes into there, it could get necrotic or start to break down your skin or make it die. And then that would be a whole other issue that, we would want to avoid. So if you have small veins that wouldn't be very receptive to the IV, they're going to suggest either a central line or a Mediport or something like that. And I actually got my first chemotherapy infusion, which was carboplatin and Taxol, on October 12th. And so this is day 4. Day 1 and the day of, I didn't really have much symptoms, maybe like a mild queasiness, a headache that might come and go. It was very mild. That was day 1 after the infusion. Day 2, very nauseated. They gave me, 8 milligrams of Zofran to take 3 times a day if I needed it. I only took it twice. So I felt okay in the morning, and then afternoon, and then for bedtime I took it. I did wake up on day 1 and day 2 very shaky. My hands were very shaky, almost like a blood sugar dropping or hypoglycemia. I have been feeling that a little bit. Day 1 and day 2, and then day 3 I also felt that a little bit. It was less, but day 3 I was just very tired and lethargic and just didn't want to move. When I did move on day 2 and 3, it just felt like my muscles were burning, like you're working out, and I was just walking across the room. So I felt that it was almost like I was working out really hard, when your legs start to burn or your muscles start to burn when you're working out, for very simple kind of movements. So you imagine those kind of feelings on an older body that has more comorbidities, what I mean by that, maybe they have diabetes or heart disease or arthritis or any other kind of medical condition that they're dealing with on top of their advanced age, where they're not recuperating as fast as someone that's younger. And here I am, day 4. I woke up just slightly shaky. I went for a walk. I went for my, mile, whatever walk. I'm trying to be gentle with my body and not put a lot of expectations on myself, especially this first round, just see how it goes. And then after this first round, I'll have a better understanding of the type of support that I'll need and what I'll be capable of going forward. So I get one infusion every 3 weeks or 21 days. So my next one isn't until November 2nd. And so far I'm just seeing that if I'm getting this infusion on a Tuesday, I will probably not be doing anything for the next 5 or so days at least, and your immune system is knocked down for about 5 days, and then it starts to recuperate from there. So you're the most vulnerable in the 5 days after your infusion. So you want to be very careful with who you interact with and where you go during those 5 days. And they told me that this type of chemotherapy isn't as harsh as other types of chemotherapy. My age is a good thing that's going for me. My lifestyle is a good thing that's going for me. And I felt really good hearing those things. And so far it's been true. And, got one down, 5 more to go. So that's where I'm at. This port, let me tell you about this port a little bit more. So what they'll do is they'll stick, it's like a needle it's like this, like a silver, it's like a little right angle, and they stick it straight in, so the one part sticks out, and they infuse it straight through that silver needle. And I put a cream on it, a numbing cream, 30 to 60 minutes prior to my infusion. It's numb. They put it in. I didn't feel anything. So I didn't feel the infusion go in. They're putting lots of fluids in me, and I had to pee a lot. So I kept getting up to go to the bathroom. And so that's where I'm at in my treatment. And I feel very fortunate that this first one went as well as it did. I've read that it can get worse as time goes on because you're doing this more and more to yourself, so it can kind of build up, but it varies by person, and I just cannot believe that it went as well as it did, being like, with my history of how sensitive I am to things. I just did not see this coming, that it was so mild. I was down for a couple days, but wasn't hovering over a toilet, wasn't stuck in bed or anything, just kind of like a sloth, just kind of hanging around, not feeling so great. So that's where I'm at, and I just want to thank you for watching. And there's more to come, and hopefully in the next few weeks I'll have some other things to talk about. All right, you guys, take care.